I enjoy taking care of all different types of patients with heart failure. There's nothing that I find more rewarding than taking a patient and essentially curing their disease and getting their heart back to normal. So I'm the program director of the Advanced Heart Failure Fellowship here at WVU. It's a one-year program. Currently, we're accepting one fellow per year. Our Advanced Heart Failure Fellow spends time both inpatient, taking care of some very sick patients, as well as in the ambulatory setting. Gets ample experience with patients pre and post cardiac transplant, as well as those that receive durable mechanical circulatory support in the form of left ventricular assist devices. That fellow is also very involved in the care of sick patients with cardiogenic shock who are receiving temporary mechanical circulatory support. There are varied diagnostic decisions, treatment decisions, and further management decisions that we all make in a multidisciplinary environment. Our Advanced Heart Failure Fellow takes part in didactic lecture series as well as a heart failure specific journal club series. They take part in quality improvement projects as well as clinical research. Our Advanced Heart Failure Fellow, by the completion of their fellowship, will be competent in heart catheterization, particularly right heart catheterization, as well as endomyocardial biopsy. They should be very comfortable taking care of patients who have gone through transplant or LVAD. They will be well prepared to go on to independent practice or further fellowship training.
When they finish here, they are able to not only practice with excellence, but also lead.